Welcome back to another episode of the Breastfeeding with Confidence podcast. Today we are talking about Prenatal Colostrum collection. We are going to be answering some of the most common questions I get and digging into some misconceptions or misunderstandings about prenatal colostrum expression. Hey Mama Bear, welcome to the Breastfeeding with Confidence podcast. Do you dream of bonding with your baby through exclusive breastfeeding, but worry about breastfeeding pain or low milk supply? Maybe you're struggling with breastfeeding and no one seems to have any answers. I'm Jaimie, doula, international board certified lactation consultant, and mom of 5, and I have been where you are. After working through painful latches, milk supply worries, and postpartum depression, and supporting countless mothers through their breastfeeding journeys for over 8 years, I'm here to tell you breastfeeding doesn't have to be perfect to be positive. Each week, I'll share breastfeeding tips to help you prevent and overcome unexpected breastfeeding challenges so you can actually enjoy bonding with your baby. If you are ready to shut out the toxic whispers of the world, embrace your God-given intuition, and release your inner fierce mama bear, grab some coffee or your favorite herbal tea and let's dive in. But before we get started, I wanted to ask you a question. Do you know what you're going to do if you go into the hospital to give birth and the nurse walks in and hands you a bottle of formula and says that your baby needs this? Will you know what to say? Will your partner know how to back you up? Or are you going to fall for the pressure, just get through it, and say things will be better once we get home, and then go home and everything just starts falling apart? Unfortunately, that's what I see with so many of the moms I work with, and I don't want that to be you. That's why I created the Breastfeeding Prep and Thrive program. It's for moms just like you who want to breastfeed, who believe in their body, but don't want to wait for things to start falling apart to start learning. Inside the Breastfeeding Prep and Thrive program, you are going to get prenatal breastfeeding screenings. You're going to get a special curated welcome gift. You get me on call the week your baby's born for your first postpartum breastfeeding consult. And then you get 6 full weeks of support with 2 additional consults and weekly check-ins and messenger support. That doesn't even include all of the resources, perks, and extras that are thrown in to make sure that you can get answers any time of the day and night when you need them before breastfeeding spirals out of control. Mama, you cannot afford to wing this and just hope for the best. Not with all of the pressure society is putting on moms today. If you want to make sure you are setting yourself up for real success and you have the support you deserve when you need it most, visit breastfeedingprep.com to learn more about the Breastfeeding Prep and Thrive program.
When you are pregnant for the first time and your body starts leaking colostrum, it can be one of the wildest, weirdest experiences ever. I distinctly remember wondering what the heck that cheesy crust was coming from my nipples the first time I was pregnant. And it was colostrum. Your body starts making colostrum during pregnancy as early as 16 weeks. Your body is preparing to make milk for your baby, and it is so amazing. So today we're going to talk a little bit about colostrum and what it is, but most importantly, we're going to discuss prenatal colostrum collection. Raise your hand if you've ever heard of prenatal colostrum collection. All right, so what is colostrum? Colostrum, again, is that first milk. It is that golden, thick, concentrated, amazing milk that your body makes before your baby's born and during the first few days of your baby's life. It is jam-packed with immune protective properties, gut healing enzymes. It is literally designed by God to be like your baby's first bolus of magical wellness, even if you do not plan on breastfeeding, which if you're here, I assume you do. But even for moms who do not plan on breastfeeding, giving your baby colostrum in the first few days is an amazing, special, important gift that I recommend everybody tries to do. It is super, super sticky. So for some moms who are leaking during pregnancy, it might crust up and kind of stick to their bra. For others, they notice they have lots of colostrum and they actually leak large amounts. both are considered normal. Both are within the realm of normal, and it doesn't matter if you have a ton of colostrum or no colostrum at all that you notice during pregnancy, your body can still make milk. Some moms are super, super worried about making sure that their baby is getting enough in the first few days. Before your milk transitions, before you have large volumes of milk, your baby is living off colostrum. All right, so here is why people talk about collecting that colostrum prenatally and what the heck you're going to do with it and how you're even going to do it, right? The benefits of collecting colostrum prenatally, that is such a tongue twister. Oh my goodness. Okay. The benefits of collecting colostrum prenatally is that if your baby needs to be supplemented postpartum for any reason, you can have that colostrum to give your baby your milk instead of having to turn to formula. Now, what are some reasons that you might have to supplement postpartum? One of the biggest concerns is really low blood sugar in baby. So that's not to say low blood sugar is a big concern for every baby, but some people and some babies are going to be at a higher risk of low blood sugar after birth. And typically, the way that this is handled, it depends on the hospital that you're at and the region you're in and everything. But typically, if your baby seems to have low blood sugar, we want to focus on getting them colostrum, getting them breast milk, keeping them latching, spoon feeding them, hand expressing colostrum, spoon feeding them, getting them as much colostrum as possible. If that does not help their blood sugar stabilize, then often the next step is using like a glucose gel inside the baby's cheek or lip to help bring up their blood sugar. Unfortunately, not all hospitals have that as their standard practice, and not all hospitals offer that. So then the other options are either sugar water or formula. Sugar water is not a great option, so many hospitals do not offer that either. And for some hospitals, they just go straight to formula if the baby's blood sugar is not stabilizing with breast milk. If you do not want to give your baby formula, that is okay. You have that right. You should not have to give your baby formula. You should not feel pressured into giving them formula. You should have those other options. But if you don't have those other options, then you want to make sure that you do have some options. And that's why prenatal colostrum expression can be so beneficial, because then you actually have that supplement there to give your baby to make sure that they are getting what they need, but it's also from you. It is not the formula that you are so dead set against. So people who would be at a higher risk of this would maybe be people who are at a higher risk of preterm labor, people who are gestational diabetic, have a higher risk of having a baby with low blood sugar. If you are anticipating having a larger baby, maybe you had larger babies in the past, that could also put your baby at a higher risk for low blood sugar. Now, we can talk a lot more about that. If you go back to my gestational diabetes episode with Nurse Sarah, we talked about how we can reduce the risk of baby's blood sugar dropping postpartum by managing your blood sugar during pregnancy. One thing that tends to be a misunderstanding when it comes to prenatal colostrum expression is that people believe that you can only start expressing colostrum if you are full term. Full term tends to be considered about 37 weeks. However, you really can typically start collecting colostrum as soon as you start experiencing leaking of it. If you are not experiencing leaking of it, but you still want to express colostrum, you can try to hand express. Typically, we recommend around 34 to 36 weeks, but if you are leaking, you can collect it sooner. Some people, however, are really afraid of recommending this. They think that it's dangerous and they think it could put them into preterm labor. That belief comes from the fact that when you hand express milk and you stimulate the nipple, you are stimulating oxytocin. However, hand expressing does not release large amounts of oxytocin that are uncontrollable. When you are pumping with a breast pump, that is going to stimulate higher amounts of oxytocin. It's more sustained, it's more continuous. Even then, we can back off and we can stop if we're feeling cramping or anything that is a red flag. But typically, if you are not on pelvic rest, aka you are cleared to have sex, then you are safe to hand express colostrum. Orgasm has a lot more oxytocin flooding through your body than hand expression ever will. So if it is safe for you to have sex, it is safe for you to hand express. If you are on pelvic rest and it is not safe for you to have sex, it is not safe for you to have an orgasm, then we may need to be slightly more cautious when we're discussing prenatal hand expression. However, typically, prenatal hand expression is not going to hit anywhere near the levels of oxytocin that would be required to actually put you into labor and cause any problems. So the concerns about being high risk and prenatally expressing colostrum usually are not that. They're typically more rooted in fear than science. Let's just put it that way. Moving on, I have heard a lot of misconceptions about how to get the milk out. So we talked a little bit about how we probably shouldn't be pumping to get colostrum. Well, I've heard some moms say that they've been pumping prenatally. They've been trying to express this colostrum with their pump and they're not getting any, and that means they won't make breast milk. Well, first of all, colostrum is super sticky, so it responds better to hand expression than pumping anyway. Second of all, lactogenesis 2, which is the stage of milk production after your baby is born, is actually initiated by the placenta releasing from the uterine wall. So when the placenta releases from the uterine wall and is then delivered, that signals your body to kick the milk making into high gear and start transitioning to that normal milk that we think of as being white, creamy, higher in volume. So if you are not producing a ton of colostrum prenatally, that's okay. That does not indicate that you will not make breast milk just because you're having a hard time pumping colostrum during pregnancy. How do we hand express colostrum is a great question. I tend to see some pretty interesting videos and interesting demonstrations of this. Typically what you want to do is, instead of pinching the nipple, we don't want to focus on pinching the nipple. We want to go just behind the areola and press back against the chest wall and slowly massage forward while squeezing and compressing. This motion is going to more closely mimic a baby pushing against you with their chin and stimulating the sucking motion. So we don't want to just pinch the nipple to try and get milk out. We want to actually massage the ducts, massage it through the ducts and stimulate it coming through the ducts, from the breast through the ducts. Some people will recommend hand expressing into like a little medicine cup or using a syringe to collect drips and drops of colostrum on the nipple. I really, really, really love the little silicone colostrum bottles. I think Haka makes some, and then there's some off-brand ones that are the similar design. They're like little silicone bottles, maybe 2 milliliters, 5 milliliters, something really small. And they have like a little cap, and they're super soft. So you can hand express and straight into them, and they're super soft on the nipple. It's super gentle. Because they're silicone, and then you can close the cap. They can go in the freezer, and they have a little dropper top so that you can very easily drop it into your baby's mouth instead of like doing the whole syringe thing. Like, I don't know. I just don't like syringes. I find them weird and frustrating. They feel very clinical, and I also feel like storing them is just like, I don't know. I've got this weird, like, somebody's going to just randomly shoot it and it's going to go to waste. And that's probably not ever going to happen. But I feel like they also take up a lot of space if you have an extended syringe that's like 6 inches, 8 inches of space compared to a compressed syringe. So the bottles, the little colostrum collection bottles are like 3 inches, maybe. They're very small. And they've got that dropper top, so you can just drip it in your baby's mouth, or you can put it on a spoon and spoon feed them however you deem necessary. You can feed it to them very easily. I love those. I think they're amazing. They're a great tool for postpartum that I've personally used. And I will go ahead and link to those in the show notes so that you can see what I'm talking about.
I hope you have found this helpful. I hope that if you are considering prenatal colostrum expression, you feel like you know a little more about when and why to do it. I hope that you feel safe and confident choosing to collect colostrum. And please, if you do struggle to collect colostrum, do not believe that you are broken. Do not believe that you will not make milk. There are alternatives if you do not have colostrum to freeze and take to the hospital with you and you want to avoid using formula for supplementation. There is donor milk available. You can do private donor milk sharing. That always gets a little controversial, specifically when bringing it into the hospital, because hospitals do not want to accept the liability of you using private donor milk. However, remember that your decisions are yours and yours alone, and they should be made from a place of information and intuition. If you need breastfeeding support, I have the breastfeeding resource guides that you can find at littlebearlactation.com/bundle. I have the Breastfeeding Prep and Thrive program for pregnant moms who want to set themselves up for success from the start. And if you are in the thick of it right now and you are needing breastfeeding help, we can set up a 6-week support system at ineedbreastfeedinghelp.com. All right, Mama Bear, that is a wrap for today. If this episode helped you feel a little more confident or a little more prepared for breastfeeding, can I ask you a quick favor? Go ahead and leave me a review. It helps other moms find this podcast and join us in this amazing community of fierce and confident Mama Bears. And hey, if you know a friend who could use some encouragement or real talk about pregnancy, breastfeeding, and all things motherhood, share this episode with her. You've got this, Mama Bear. Trust your instincts, stay fierce, and I'll catch you in the next episode.